Hello, my name is Eric, and this is Nursing 440. I will be presenting my vulnerability chart and the 6 risk factors of homelessness slash poverty, mental illness, rural and migrant health, infectious diseases, addiction, and violence, and how they're all interrelated and risks for vulnerability. So we'll start with homelessness slash poverty. They're pretty related since poverty can lead to homelessness. And population that fit in this area are vulnerable because they have limited access to healthcare services due to financial reasons, um, poor compliance with medications for the same reason, financial reasons, um, uh, lack of education and resources. And because of that, they also have poor health management and um, a lot of it due to inadequate education. And as I said, poverty can lead to homelessness um, as well. Mental illness, um, inability to care for oneself due to cognitive impairment or mental instability. Because of that, that can lead to poverty due to inability to function to do a job, um, and can lead to homelessness as well. Rural and migrant health, um, because of the distance where this population lives, um, they have a long way to go to visit a doctor or to seek medical attention for even just minor things. So they have a higher risk of developing chronic diseases because of lack of treatment and monitoring. Um, because of geographic isolation, it can be discouraging to uh, follow uh, medical offices frequently. Um, Populations in this area also have fewer years of formal schooling for the same reason. Um, Difficulty getting to many schools, universities, so it creates a great inconvenience. Um, Also makes it difficult to afford healthcare because many of the times um, this isn't a largely populated area, so sources of income are limited. And also infectious diseases. Um, these can create a physical disability. They can be created because of a lack of resources for healthcare. Um, Rural or homelessness, poverty creates a higher risk for this. Um, Not following the doctor often because of being homeless or lack of money, or living in an isolated area can lead to poorly cared for infections or wounds that can become pretty bad and even disabling. Addiction. Um, so the population who is addicted, they will use their resources very poorly. A lot of money or financial aid will be used towards the substances they need because if they don't, they'll have withdrawals. So it becomes more of a physical need, even if their emotional state of mind isn't there. Um, and priority mismanagement. So they will use sources of income. They will use any sort of resources, acquaintances, families to ultimately obtain and maintain their substance abuse. Um, Violence. Um, Risk factors are um, for vulnerability are because of fear to search for help. Um, it can also create a psychological trauma and mental disorders in adulthood because of that. Uh, as a child, sexual, physical, emotional abuse um, creates instability as a person grows up. And these are all interrelated in manners such as I said, mental illnesses can create a can have a person be incapable of caring for oneself, so they can hold a job, they can become homeless. That can lead to infectious diseases where they can't seek medical help or they won't. So they'll be predisposed to um, anything like pneumonia, to infected wounds, to um, maybe ulcers on their feet because they're diabetic and they can't care for that. This also leads to a lot of stress, a lot of exposure to substances such as heroin, methamphetamines, alcohol. So this can lead to addiction. This can also lead to violence because of substance abuse. Um, so this is ultimately all interrelated, which creates vulnerability for that population. And that concludes my presentation. Thanks for watching.